if you're feeling unsure or uncomfortable in the context of a new or a redeployment, please ask for help when you need it. Talk to your colleagues or reach out to your leader because they're there for you.
The enabling legislation does allow healthcare professionals to provide care outside of their regular scope of practice. That was one area of the legislation. The second was around enabling movement of healthcare professionals around the province as well. And in addition, there was language to allow for protection of staff, given that they would be providing care out of their traditional scope.
In contrast to the province, we see a continuous increase in number of admitted patients here in the city of Hamilton, so no flattening here yet. And the same with ICU, right? Every week we see a significant increase in the total number of ICU patients. Not as much an increase anymore with intubated patients, at least comparing this to the week prior.
The second piece of sort of cautious optimism is, at least for the month of May, we have higher supplies of the Pfizer vaccine than we've seen in other months. And so that's allowing us here in Hamilton to really effective today to see a significant number of new vaccination slots become available. Some of them to be booked through the provincial vaccine appointment booking system, and some of them available to be used for pop-up clinics, et cetera. So, that's going to take us from where we stand today of 34% to very well into the 40% range and even into the 50% range by the end of May.
There will be critical clinical decisions that need to be made along the way, and we're not going to shy away from those. We're absolutely going to be clear that those kind of critical clinical decisions will go out to the clinicians and all those involved in the work group so that we make the right decisions for the HHS version of the Canadian Foundation System.
Let's all keep our fingers crossed that the cautious optimism that was expressed by Dr. Mertz comes into play over the coming weeks. But in the interim, I know I can say on behalf of the whole executive leadership team how grateful we are to everybody for digging deep for our patients and for our community. So thank you all for continuing to do that.